Hi, this is Tate Johnson. I'm going to be doing my endotracheal suctioning skill. First, I'll do a quick room scan. All right. I think that looks good. All right, so the first thing I'm going to do is perform my hand hygiene. And then I'm also going to go ahead and gather my equipment, which I have here on the bedside. And then I'm gonna go into the room, knock. Hi, my name is Tate. I'll be your student nurse today. I'm just gonna be listening to your lungs, seeing if we need to do any suctioning for your trach. Okay? And then I'm gonna go ahead. Could you tell me your name and date of birth? All right. I'm gonna verify that with the wristband. Matches. And yeah, to explain what I'm gonna do. So, are you in any pain right now? No, no pain? Okay. And if my patient was in pain, of course I would stop the procedure, get them their pain meds, wait the adequate amount of time, and then proceed with the tracheal suctioning. So, now that we've got that, and my patient is conscious, responding to me, so I've got them in the semi-Fowler's position here. If they were unconscious, they would be supine and facing towards me. I'm quickly just going to do a quick assessment of your lungs here to see if we need to be doing any suctioning, okay? Alright, can you take a deep breath for me? And again. Again. Once more. Okay, so I am hearing some coarseness and some crackles in there, so we are going to go ahead and get that stuff out of there for you, okay? Do you have any questions? Alright, and before I do anything else here, I'm just going to make sure that my suctioning is set up properly. So I've got my suction tubing here, and looks like over here we have about 150 millimeters of mercury, which is going to be the maximum suction rate that we're going to be able to do with an adult. So I'm also checking, making sure that the suctioning is working with my clean glove right here. Looks good. So with all that good, I'm going to go ahead and get all my equipment here set up. I've already checked and ensured that all of it is not expired. And yeah, it all looks good there. Nothing's opened. So I'm going to go ahead and put on some clean gloves. Open up my kit here. And since my sterile water here has been opened, I'm going to lip it before I pour it in there. Lip that into the garbage. Okay. And now I'm going to put on my sterile gloves. Well, before that actually, I'm going to place this towel on my patient. And you let me know if at any time during this suctioning, if you feel uncomfortable, you feel like you can't breathe, just raise your hand up just a little bit, okay? Can you demonstrate that for me? Okay, perfect. I'll make sure you can see this. Okay, I think that looks better. Classic. I grabbed the mediums for my sterile gloves. That was probably a mistake. Anyway, got my sterile gloves on now. This is my left hand. This is going to be my dominant hand, and this will be my sterile hand. This one is going to be my clean hand. Okay, and before we get started, I'm going to go ahead and hyperoxygenate my patient. And I'm obviously in a clinical setting. I'm not going to be touching anything, but I want to move the camera so you can see what I'm doing here. Okay. Gosh. Alright, that looks better. Alright, so I'm going to go ahead. I'm going to remove the oxygen, okay? And I'm going to just bag you a little bit, so you're going to be able to be a little bit more comfortable while we're doing this, okay? All right. This is the oxygen, by the way. All right. I'm going to bag my patient for 30 seconds. Now I'm going to go ahead and attach. And then I'm just going to run some water through there, make sure that we're getting suctioning. It's good. Clear it. Alright, I'm going to go for the first pass now, okay? Take a few deep breaths, just relax. And then I'm going to put it into the predetermined length. And I'm not going to be suctioning while I'm going in. And then I'm just going to be doing intermittent suctioning while I'm twisting my way out. Okay. Now I'm going to replace the oxygen. I'm going to run some more sterile water through. Get all my secretions cleaned out. Looks good. And I wouldn't do the suctioning for more than 10 to 15 seconds at a time. And I'll wait 30 seconds to about a minute between passes. Doing okay? All right. I'm going to go for my second pass now. I'd hyperoxygenate if needed. All right, here we go. And I'm going back in. And same deal, it's just suctioning intermittently while pulling out. All right. Go, clean that. Place the oxygen. All right, 30 seconds have passed. Is it okay? You're doing all right? Wonderful. All right, we're gonna go do the third pass. Okay. So I'll replace the oxygen. Make sure my patient's comfortable. And then I'm going to take this, I'm going to wrap the glove around this, throw that away. And also get rid of this glove. I'm going to put on some clean gloves. God forbid. All right, so I've got my clean gloves on now. Now I'm just going to replace your cannula, okay? All right. So I'm going to open my cannula packaging and I'm going to be mindful to not touch this clear part or let that touch any part of the packaging there. I'm just going to be touching the red cap there at the end. All right, I'm going to take your oxygen off for a moment here. Take this off, pull the old one out. I dispose of this. And then carefully slide this one into place. Replace the oxygen. Okay, so now that I've done that, I'm going to grab my stethoscope. I'm just going to listen to your lungs one more time. You still doing okay? All right, take a deep breath for me. And again. Okay, again. One more time. Okay. Wonderful. Okay. And then, so yeah, the lungs sound a lot clearer now. I'm just going to make sure my patient's comfortable. And of course, throughout this entire time, I'd be monitoring their oxygen sats, making sure that they're not showing any signs of cyanosis or any difficulty. And if they were, would have stopped immediately and addressed that. Yeah, so I'll put my patient down in the lowest position. Is there anything else you need? You're doing okay? All right. I'll get my patient their call light. Like so. Make sure their oxygen's on. And then I would clean everything up, document that I replaced the cannula and did the endotracheal suctioning.